All right, let's dive into something pretty fascinating. We're talking about that delicate, almost magical connection between our brain and our voice, and what happens when that signal gets, well, scrambled.
I mean, have you ever really stopped to think about it? You get a thought in your head, and boom, in less than a second, your brain fires off a whole symphony of signals to make you speak. It's amazing. But what happens when that signal gets distorted somewhere along the line?
So we're going to explore what happens when the issue isn't the hardware, the vocal cords themselves, but the software. The problem is buried deep inside the body's main control center, the central nervous system, or CNS, and the commands it's trying to send out. And that brings us to this condition called dysarthria. Now, this is really important. It's a speech disorder, not a language disorder. The person knows exactly what they want to say. The ideas, the words, they're all there, but the neurological damage just stops the muscles from getting the message clearly. But here's the thing. To get a dysarthria diagnosis, the disruption can't just be one little thing. It's got to be systemic. It has to mess with all four of the critical systems that have to work together to make your voice happen. Yep, all four of them. You've got respiration, that's the power from your breath. Phonation, the sound from your vocal cords. Resonation, which gives you your tone. And articulation, the final shaping of words with your tongue and lips. If one link in that chain is broken, the whole system just, well, it stumbles. Okay, so now we kind of get what it is, but let's look at the different ways it can show up, because it turns out where the damage happens in the brain pretty much determines everything about what a person experiences. And this is absolutely the key point. It's all about location, location, location. If the damage is in the cerebellum, you get one set of problems. If it's in the basal ganglia, you get a completely different set. It's like a roadmap of the brain that points to very specific speech issues. And you can see on this chart just how varied it can be. It's really a whole family of conditions. You can have problems with muscle tone, from the weak, breathy voice of flaccid dysarthria, all the way to the stiff, strained voice of spastic. Or it could be about movement itself, from the too little movement you see in Parkinson's, which gives that mono-pitched voice, to the too much, involuntary movement in Huntington's.
So that table gives us the clinical bird's eye view. Now let's dive a little deeper and see what this spectrum actually looks like in some of the most common conditions.
Let's start with two types that are basically polar opposites. Spastic dysarthria comes from damage to the upper motor neurons. Think of them as the managers inside the brain. This makes the muscles stiff and the voice sound really strained. Flaccid is the exact opposite. That's from damage to the lower motor neurons, the nerves that go right to the muscles. That makes everything weak and floppy, which gives you that breathy sound. And here's another pair of opposites. Hypokinetic means too little movement. The classic example is Parkinson's disease, with that flat, quiet, monopitch voice and rigid muscles. On the flip side, you have hyperkinetic, meaning too much movement. Think of Huntington's chorea, where random, jerky movements cause these erratic bursts of sound. Now, ALS is a really tough one because it's what we call a mixed dysarthria. It often combines both spastic and flaccid symptoms, since it attacks both the upper and lower motor neurons. And for about a quarter of patients, the very first sign isn't in their arms or legs, but in their speech, a type they call bulbar onset, which tends to mean the disease progresses more quickly. Multiple sclerosis, or MS, is another mixed type, usually a combination of spastic and ataxic dysarthria. It typically shows up in younger adults, and what really defines it is how unpredictable it is. Symptoms can flare up and then just seem to disappear for a while. It's a real roller coaster. So, we've looked at the clinical side of things. But what does it actually feel like to live with this? To really understand the human impact and see what the path forward can look like, let's zoom in on the story of one patient with Parkinson's disease. This is what she said before she started therapy. Can you imagine that? The simple act of talking, something you've done your whole life without even thinking, suddenly becomes foreign and difficult. She felt like she was losing a part of herself. And this part, this really gets to the heart of it. The social isolation that comes from losing your voice is just profound. When you feel like you can't be heard, you feel invisible. It's not just a physical problem, it's a deeply, deeply emotional one. So this brings us to a really crucial point. Because the underlying nerve damage can't be reversed, therapy isn't about finding a cure. The goal is compensation. It's about maximizing the skills a person still has and learning to manage the symptoms as best as possible. And for her, the core of her therapy was a simple, powerful mantra. Think loud. See, Patients with Parkinson's often think they're speaking at a normal volume, when they're actually very quiet. This simple command helps them completely recalibrate their internal sense of effort. It's like they're relearning where the volume knob is. And the result is just everything. This was the moment her daughter heard her mother's real voice again, not the quiet, weak voice of the disease, but her. That's a moment of pure recognition, of reconnection. That's about reclaiming your identity. So we've taken this journey from scrambled brain signals all the way to the mechanics of therapy. But what this patient's story really drives home is that finding a voice again, it's about so much more than just making sounds. At the end of the day, this isn't really about vocal mechanics or neurology. Our voice is so fundamental to who we are, to how we connect with everyone around us. And helping someone get that back, well, that's not just about restoring speech. It's about restoring a vital piece of what makes us human.